Hi everyone, this is Dr. Jonathan Kuttner. I'm going to look at something which comes up really quite often, and that is the question of treatment of trigger points. Firstly, how often should you treat them, and how many should you treat? How should you feel after treatment? Okay, so a lot of it I see as common sense, and the interesting thing about common sense is that it's not really a common commodity. So a lot of the time, because of ideas, common sense goes out the window and other things occur. To my mind, the treatment of triggers, if you follow ischemic principles, so this is where you find your trigger, you press just firmly enough to know you're on it, reduce the pressure, stay on it, just below the pain threshold, gradually increasing the pressure and switching it off. Now, if you do that way of treating triggers, then what tends to happen afterwards is that it just feels more comfortable. You then stretch it using a neuromuscular technique, and there'll be a link below here that you can click on, and you can learn these principles in more detail. If you do that, then what tends to happen afterwards is it just feels better, feels more comfortable. And the thing is, if you treat a number of triggers in the area and you're patient and you're gentle with yourself, then what should happen afterwards when you put some heat on is that the whole thing just feels more comfortable. If it's really, really, really reactive and the triggers are very, very tender, then it's not uncommon to have a small flare. And that's because you've interfered with something that's really hyped up and grumpy, and your body and your pain system may react. Normally, the length of time that you feel discomfort would be from a few hours to maximum sort of 12, max 24 hours. But usually that means you've kind of beaten yourself up if you're treating yourself. If, however, you go along and see somebody and they come from the school of no pain, no gain, so you have somebody who, say you've got buttock triggers and they get their elbow in and you're just about dying, and then they hold it and grind it in, or you have acupuncture, which is dry needling, or wet needling, which is injection of tiny little bits of local anesthetic into the trigger points. If you have that kind of treatment, then really probably 30 to 40% of people will feel more pain following that kind of treatment, and the length of time is usually a day or two. Because what your body does, especially if you have injection of local anesthetic, is that you have to wash it away before you then enter this new phase where all your pain system is quietened down and everything has you've pushed the reset button and everything has gone back to normal functioning. So how many triggers you treat? Well, if you're treating yourself, what you do is you treat yourself as if you were treating yourself. In other words, you give yourself time and space. You choose just a few of the most painful triggers, just treat those. See what it feels like. See what it's like the next day. Then you may find that some of those need another treatment. You may find that there are others. And you don't kind of really dive in and treat yourself for an hour, because you're overdoing it. The thing is, your thumb will wear out, or if you're using a Theracane, you just got to be very gentle. And that's where I use that idea of common sense, is that you can judge how well you're doing by how well you feel afterwards. And so 15, 20 minutes, and you can absolutely treat yourself every day. If you've got lots of triggers all over, chip away at this bit, then down here, then over here, and so on. So I'm being vague because there is no one size fits all, but the idea is be gentle with yourself, do it in a way so that afterwards you feel a lot better, and just gently work away at it. And over time you'll find things get quieter and quieter, and you just go from strength to strength. Thank you.